Who are dual eligibles and why do we care about them? Welcome to the CarePayments podcast. I'm Fady Sahhar, president of XtraGlobex, and with me is Fady Sahhar, co-author of the Value-Based Payment Clock and DEHQ.
So this is our second podcast. It's awesome. As a reminder, the goal of the CarePayments podcast is to have a quick hitting but informative discussion about healthcare payment models, how they affect MCOs, providers, payers, and care recipients. As an advocacy-first group, we want to make sure consumers have the best access to information and quality care as possible.
Today, we're going to discuss this particular group of dual eligible consumers and how the changing healthcare environment is affecting them and how we can help prepare for those changes.
Yeah, because there's a lot coming in the next couple of years. So who are eligible consumers, dual eligible consumers?
So dual eligible consumers are people who are eligible to receive both Medicare and Medicaid. They receive payments through their Medicare program because they're generally over 65 years old, and they receive Medicaid from their state Medicaid plans because they're generally unable to afford their own health care. And so the dual eligibles bring these two largest sources of payments together, and we're looking for ways to serve them better.
Okay, great. So what are these dual eligible programs?
So dual eligible programs are programs that combine the Medicaid services and the Medicare coverages. As you know, they are usually, if it's an elderly person, you may have as many as 2 or 3 payers who need to cover the expenses of the medical coverage before you get to Medicaid. So in this case, whenever we have individuals who are eligible for both Medicare and Medicaid, we face some significant needs for coordination of payments to make sure that we are sequencing the payments appropriately to those organizations or payers who are most responsible for them.
And with the baby boomer generation, right, the population is massive that potentially needs this type of care.
Absolutely. Right now, the estimates is in the next 5 years, we'll be seeing close to 15 million individuals in the country who will be in the dual eligible population. So and these individuals, just by the nature that they are older and tend to come from a lower income environment, usually have much higher care needs and tend to be quite expensive to serve. So that's why we're paying so much attention to what's going on in this environment.
All right, great. That makes sense. So it kind of leads me to my next question. Why are these programs so important?
Well, as we said a minute ago, there could be as many as 3 payers who are responsible for the expenses associated with an individual. The first one might be a teacher's retirement plan that might have some coverage associated for the individual that pays the first $2,000 of expenses. Then kicks in Medicare, which is becomes the primary coverage for this individual, and that has its own limitations. Medicare is available to anybody over 65, generally speaking, and then if a person is unable to afford the additional expenses after Medicaid coverage is gone, because you usually have supplemental. Medicaid usually covers Medicare only 80% of the expenses. And so that remaining 20% usually comes out from an individual's pocket. If the person cannot afford to pay for that, that's when Medicaid kicks in.
Got it.
And as a result, that combination creates a great deal of requirements to coordinate the care and make sure that whoever is delivering the care is billing the appropriate people first. But it's also such a great opportunity because if we can bring these payers together if we can help them become more cohesive together, we will be able to optimize that spending, utilize potentially lower cost services in order to deliver the better total package for that consumer.
That's sounds complicated, to be completely honest, right? It sounds like the process isn't clean right now. So how is the government involved in all of this?
So the federal government is responsible for nearly 85% of the dollars that are expended on the dual eligible population.
Wow.
So because you think of it that Medicare covers the 80% essentially, and then Medicaid covers the remaining 20% or so, but the federal government contributes to Medicaid. So they end up with a much higher share. So the Center for Medicare and Medicaid Services is creating regulations that will be moving in the next 5 years, where these programs need to come together. They need to be combined into dual eligible special needs plans and other similar structures that leverage the Medicare Advantage structure that is now becoming pretty dominant in the delivery of Medicare. I think it's
Yeah.
important. Because what happens is that if you have multiple payers, there's a real problem for the consumer. The consumer ends up at the short end of the stick because all the
Mhm.
payers want to avoid paying for it,
Of
right?
course.
And if you create a single door, if you create a single pathway for the delivery of the services, that pathway can look for optimizing the spending and therefore reducing the total cost of care rather than pushing the consumer around to determine who will help them and who will pay for the services.
Yeah, I mean, that sounds like a really great concept, and obviously they're working on that concept. But currently, the challenges that lie in front of them are fragmented care and access to providers. There's a lot of confusion with the enrollment processes. So, how long do you think it's going to take to actually get that single door program?
Well, right now we have a goal that by 2030, which is 5 years away, that consolidation will take place. That the federal government is putting together regulations, which will probably evolve. And whether we do it in 5 years or in 8 years, that's not really the issue. The bigger issue is that at the end of it, we're going to be able to support the consumers we serve much more effectively. The providers who participate in those networks are going to know much better what they're going to get paid and how they're going to get paid. And the payers will be able to really coordinate their activities a lot more effectively.
So,
So
honestly, better for everybody.
we see it just like we've talked over the past couple of years about how value-based payments improve quality. This is another part of that continuing journey towards creating better value, better quality, and better outcomes.
I love that. So, as we wrap up, at the beginning, we talked about being an advocate. So, as an advocate, how does what we talked about today impact our consumers?
Well, we have to help the consumer become educated about it
Mhm.
because at the end of the day, consumers have to be able to choose the single door. The federal government will not force a single door because the basics of consumer choice. And we support that. We
Yes, we do.
support that there should be a lot of consumer choice. However, there needs to be multiple single doors so that the person does not get caught up in a single option that prevents them from making better informed choices. That's the part that I look forward to being involved in to help supporting assuring multiple pathways to
Yeah,
delivering these services in a cohesive manner.
I love it. I love it. I look forward to, digging in as these things change over the next couple of years. So, as promised, short, quick, informative, lots of really good info. We have now started our new dual eligible HQ newsletter. We're really excited about it. The podcast is a part of that. So keep an eye out for that in your inbox as you're looking ahead. We hope you subscribe, and we look forward to seeing you next time.
And as always, onward.